Welcome to the podcast. Today we have a birth doula, postpartum doula, the owner of Stork's Nest, joining us today. We have Nicole. So Nicole, welcome to the podcast.
Hi guys, thanks for having me.
And so there's a lot of things that I wanted to talk to you about, mostly because the good relationship that a chiropractor and a doula can have. But I also want to get that information out, like what is a doula? You know, what do you guys actually do? The benefit. I know what a lot of the benefits are because of what, you know, all the pregnant moms and what the community's saying. But I want to hear it from you. I want to hear what you do, how you do it, and really just get this information out to people because it is so beneficial. And I know you see it, and it's almost like if people just saw what you saw, just like with us, we say it all the time. If people only saw what we see, my gosh, there'd be lineups. We need 10 offices. So yeah, without further ado, go ahead, take over. The show is yours. Thank you for joining.
Thank you so much. I'm really excited to be chatting with you guys today. I agree. If people only knew what we knew, we would, doulas would be exploding. And definitely, it is taking off. I'm so excited that more and more people within the community are understanding what a doula is and thinking like, maybe that's something that I want to have for my birth experience. Certainly when I was having my children, my eldest is 14, there wasn't a lot of hype around doulas. Certainly there were doulas. We've been around for decades, but I didn't really know much about it. And it just wasn't part of my community and there wasn't a lot of information for me. So I'm so excited that now we're starting to understand the benefits of what a doula can do. So for those of you out there who are expecting or soon to be expecting, here's a little information for you. We support all kinds of families. One of the myths that I think that a lot of people sort of carry with them from maybe a couple of decades ago is this idea that doulas only support, super natural, unmedicated, home birth, sort of that hippie granola crunchy. Not that there's anything wrong with being a hippie. I've got a little bit of hippie in me. I'm a little hippie at heart. But sometimes when people are thinking, well, I'm planning a hospital birth and I'm pretty sure I want the epidural, so I don't think that a doula would want to support me. The truth of the matter is that we're here to support all families. And we want to support your choices. And our job here is to help build your confidence so that as you're moving through pregnancy and into that birth experience, when there really are so many unknowns, especially with your first child. I mean, God, every day was a new day where you were like, wow, I learned something new about myself every single day. We really want to support those families. And so it's about supporting the laboring individual, but it's also about supporting the partner and sort of helping you not. Yes. Another myth is that we only support, individuals who are birthing, these pregnant individuals. But it's really the whole family. It's everybody, because you guys are navigating this together. And as partners, you guys have a lot of pressure to be all the things, right? Like, I don't think I've ever really met a partner that's been like, I don't want to support my partner while she's having her baby. Everybody wants to be there, but they sometimes just don't know how.
They don't know how. Like, right. Just coming from a guy's point of view, and I know you've probably heard this, for sure. You don't know. You're like, no, I'm going to stay out of it. I was a lot more involved. Like, I wanted to actually like help pull my son. So I got to do that. So that was super cool. I'm a little bit more involved than most people, but I am a chiropractor, so it's a bit different.
Exactly.
But when all the dads that are coming in here, I'm like, oh, so what are you going to do? Are you going to be right in there? And they're like, no, I'm going to be on the couch, man. And I'm like, what? Like, be part of that. It's such an amazing experience, especially the first one. Not that the other ones aren't amazing, but that first one is just such a new experience.
Absolutely. And I think it's because society doesn't teach partners how to be supportive during labor. And the truth of the matter is that society doesn't really teach women. I hesitate to say women. I like to use the term birthing individual because not everybody identifies as a woman. I slip up sometimes because it's kind of just what we're used to, but not, we're not taught how to birth our babies. We don't see it the way, we don't see birth, or we're not exposed to birth the way we probably were, 100 years ago, where we were living in villages, where we were really exposed to birth and helping with our cousins and our mothers and our siblings and all of that stuff. So we kind of live in this society where we build this fear around birth. We don't know what to expect because we're not taught it. So if we as the individuals who are birthing aren't learning it, I can tell you right now, partners are not being taught how to. So it can be daunting. It can be overwhelming.
Yes.
And I think the reality is with the medical system being what it is today, we're so lucky to live in Canada and North America. We have a wonderful healthcare system. And so never to throw any kind of judgment or shade on that. But really, it is very medicalized here in North America. We sort of lose that innate, experience that human beings were born to birth babies. So yeah, we're trying to sort of re-educate families. You can't call up your doctor anymore and say, hey, Dr. So-and-so, I'm having this issue. Is this normal? Or you have a question. You see it on TV. People pick up the phone. I'm always amazed by that. They pick up the phone and they're like, I'm just going to call my doctor. I'm like,
does that?
You can do that. I mean, I've never had that experience where my doctor has been able to take my call.
I do it. I call patients all the time.
That's why I love chiropractic. It's a different experience. You are bringing a whole other, you're filling in the gaps where our medical system is sort of,
Lacking.
Lagging. And that's doulas as well. Yeah. So when explaining to people what exactly a doula does, and a lot of people say, well, do I need a doula? No, not everybody feels that they need a doula, but most of the time it's because you don't actually really know what a doula can do or add to your experience. And so the analogy that I like to use is, and this seems to go over really well, and it helps people sort of connect the dots. So when you're going on a trip, you're in New York City or one of these big cities, and you see the tour buses, those double-decker red tour buses. They're like the hop on, hop off. You can use it as transportation, but you can use it as, information as well. So my analogy is, can you use that as a hop on, hop off, point A to point B destination? Yes, you can. But how much more enjoyable would that experience have been? And how much more information would you have gotten from that if you had just plugged in those headphones and listened to the tour guide at the front of the bus, who was literally giving you a wealth of knowledge and helping you to understand things along the way? You can get off the bus and have a great experience and enjoy the scenery, but you can also hop off the bus and be like, wow, I felt like he answered my questions or she answered my questions. And I felt like I learned something along the way. And that's sort of the way doulas are. We're kind of like the birth tour guide. We show you everything.
I love that. That's awesome. So Nicole, you touched on earlier about how your whole goal is to support the birthing individual and their partner. What sorts of things during, let's say, labor and delivery, what sorts of things would you support with? What do birthing individuals need support with?
Yeah. Okay. So sort of the main goal of a doula is we're going to provide emotional support throughout pregnancy. We're going to offer reassurance. We're going to be able to be there for you when you're having anxieties or feeling a little bit stressed about something. It's the knowledge that somebody is there for you and only you, and they're there to fill your needs. That is really, really helpful. So that happens throughout pregnancy, but we also carry that into the birth. It allows us throughout the pregnancy to build a relationship with our clients. And I'm happy to say that all of my clients, as we come out of this experience, we really do leave as friends. We have had weeks and months of getting to know one another. I get to know what their preferences are, and I help them build confidence as they're leading into the birth. And then it's also informational support during that time. So if they have questions, if there's some research that they would like to get their hands on, we can help get them the evidence-based, Dr. Google, it's kind of your friend. You can spiral down that hole really, really fast. And I've known a lot of people that have, we all do it, but how much nicer is it to, reach out to your trusted doula and say, hey, what's the information on delayed cord clamping? Or I'm hearing a lot of information regarding, this topic, and I'd like to know a little bit more. So it's informational support. We also carry that into the birth experience. Some of the things that we're learning about through pregnancy will come up again in the labor and delivery room. And we get to say, hey, remember we had a chat about this? How are you feeling about that right now? It's opening up the lines of communication so that people are feeling that birth isn't something that's happening to them, or that anything in that experience is they're being a victim in any way. They are active participants, and they are strong and confident.
Yeah, I love that. Yeah, I remember when we first met and we were talking a little bit about what you did. And I remember one thing that you said that really stuck with me. And that was that you are an unbiased support system. And I loved that because I think many people think that if they bring someone onto their team, they're going to get that person's opinions as well. Mm-hmm. And I think it's really, really important that you do provide an unbiased view, because you can provide information and allow your client to make whatever decision they're comfortable with. So I love that that's a part of what you do.
Yeah, and that touches back to the point that I think I probably got off topic on earlier, is that I don't have a preference on how people birth. I certainly know the research, I know what it tells us, but I had my own children, I had my own pregnancies, I birthed the way I chose to birth, and I certainly don't have any preferences in terms of how my clients choose to birth. If they ask for the information, I'm more than happy to give it to them, and they're comfortable knowing it's evidence-based. And then we talk through things. So a lot of times in the birthing space, we use a tool, we call it BRAIN. So when they're faced with a challenge, what are the benefits? What are the risks? When they're thinking like, oh, I don't know what to do, we're faced with this option, but I'm not sure how I feel about it. We talk about benefits. We talk about risks. We talk about alternatives. What can we do as an alternative to this decision? What is your intuition? What does your gut tell you right now in this space? And then what if we do nothing? Right. Can we sit back and take 20 minutes, half an hour, do nothing? And talk to the doctor, open up that communication between the client. We never talk on behalf of our clients. That's another important thing to understand, is that we are not these birth warriors that go in to try and save women from birth. We want women to feel empowered. I want the communication. I want them to feel confident enough to talk to their doctor about concerns. And sometimes within our medical system, it can feel a little bit like, well, I'm sorry, doctor, but I don't know how comfortable I feel about that. People are nervous to kind of question things. Yeah. Doctors are so much more receptive, and nurses are so much more open and receptive than we think that they are. And sometimes it takes that little friend in the corner to be like, hey, remember you had that question? This would be a great time to ask that.
That's a good point.
It's that support. It's that person in your corner 100%. And it really isn't about what choice you make. It's that so confident about it.
And I think that's just normal, right? You're going into that situation. You might have idea as to what you want or the questions you have. We've all been there where we're like, okay, I'm going to ask them this, this, this. And then all of a sudden you're met with that environment or that person, and they might throw you off a little bit, or the stress of the moment. And then all of a sudden you're like, man, I had so many things on my mind and they're all gone. So, it's nice to have that person. So I totally, I view it as a coach. I don't know if that's the right word for it, but definitely like a coach. It's like, I want that person on my side that's got my back, that's making sure that, the things that we've discussed are the things that we're not only fulfilling, but we're also on the track that we designed. And yes, things always come up. As you know, things always come up. But you did mention something, and right away I was going to be like, okay, what is it? So you said, it doesn't matter what they want to do, you're there to support it. But I want to know, what does the research show? Because right away you said research, and I went, bing, what does it say? Because I know in North America, I don't know what it is in Canada. I know the stats in the States are pretty bad for actually newborns and their health, and I know, or having an issue after birth. I know in the States, and I don't have the exact stats, so that's why I'm not going to say it. All I know is they're not doing too good. I know like third world countries have better birth rates and some of the health than the States. I don't know what Canada's like, but I would assume we're not too far behind just because of maybe we share a similar viewpoint and or system. But based on the science, what does the science tell us? What is like the best place to give a birth? What is just speak to the science, because I don't know it.
Yeah. So, I mean, here in Canada, we are a little bit different than the States. Our healthcare system operates differently. Even the fact that we have our universal healthcare system greatly affects, women in birth. I mean, it happens. It's an unfortunate aspect of it. And now we're opening up all kinds of conversations about race as well, and how racialized birthers are at a higher risk. And that's where we're not that far off from the States. Unfortunately, here in Canada, we don't track maternal maternal death resulting from birth. We don't track that in terms of race. So we track that, but we don't break it down. So we don't have those statistics, whereas the United States does. But I'm telling you, we're not that far off from the States when it comes to that. So you talked about where is a safe space to give birth? What is the safest? What does the research tell us? So the research tells us that individuals who are having low risk pregnancies, that are relatively healthy, have no underlying health conditions that would be concerning to birth, who are being seen by a primary healthcare physician, are quite safe to birth at home. And that's what the research is telling us. If you want to give birth in Canada, if you want to give birth at home, you would need to have a midwife. Obstetricians are typically, we would have used an obstetrician many, many years ago. They were only used for high risk birth. So we used to go to our family doctors, our general practitioners, who also delivered babies. If there was a concern, if there was a high risk issue, we got moved to an obstetrician. Now in our society, we actually have access to obstetricians for even low risk pregnancies. A lot of people don't understand that midwives are a very safe option here in Canada because we are now regulated. So we have regulation here in Canada that really puts midwives up a level and puts them at the forefront of birth, and the level of care that you can get. I believe you said you guys used a midwife as well.
Yep.
Yeah. The level of care that you get from a midwife is absolutely incredible. So we know that research is telling us that home births are quite safe, although home births are not right for everybody. Not everybody feels comfortable with that home birth aspect, and it's partly the society that we live in.
Right.
But hopefully, as more research is done, we can get to know that home birth is quite safe. And for those of you that are interested in it, it might be a really great option to talk to your midwife about.
I love it. Yeah. So right away, I think a lot of people are going to feel a lot more safe, or at least they're going to start looking at, okay, I want to go see, or at least I want information from the doula. So right away, before we even, wrap up the show a little bit, how do people reach you? What are they looking for? If they're online, because I'm going to put everything in the show notes. So everybody's going to have access to that, but how do they reach you? How do they find you if they have questions?
Absolutely. So they can reach out to me via my website. It's www.thestorksnest.ca.
Awesome.
There they will have a contact form there. It's almost like a little questionnaire, sort of what sort of support are you looking for? Is it birth support or postpartum support? Those are two very different things. They can reach out that way. They can also reach out via Instagram or Facebook. We are at the Stork's Nest Doula on both Facebook and Instagram. So that's the easiest way. And then we get in contact with them and I will ask them a series of questions. We will often have a meeting. Often it's going to be virtual right now because of COVID. Usually it's a face-to-face meeting, but I'm actually finding that Zoom meetings or FaceTime meetings are working really, really well right now. So we would probably continue to do a consultation that way. And we would talk about, what their preferences are. What is it that you're looking for? And then we can tailor a package to sort of suit their needs. One thing we didn't touch on, so we talked about the emotional support and the informational support and just having that person in your corner to help build your confidence and advocate for you. But we didn't talk about the most important thing, which is our hands-on support, which happens in the birth space. And this is where partners come in as well. We help you guys to build your confidence. So oftentimes partners want to help, but they really don't know what to do. And it takes that doula to say, hey, remember we were talking about, that back pressure technique? Like, this would be a good time to try that. Let's do that together. And so we're sort of modeling this behavior, and we're sort of giving partners a nudge to say, hey, this is how you could be really helpful to your partner right now. Oftentimes, even if an individual is looking to have a medicated birth using an epidural, there is going to be a frame of time before you get that epidural where you are going to have to deal with the very natural unfolding of labor. And that's going to be hands-on. So it's going to mean lots of physical support for you while you're trying to navigate those early, hours of labor.
Awesome. And then you also mentioned, I want you to touch quickly on the postpartum aspect, because I don't think many people know that you can have a doula postpartum. And postpartum it's such a forgotten area of that whole process. It's really the 4th trimester that everybody forgets about. So touch on that and what that's like.
Absolutely. 4th trimester is so important. It is really the new term that I'm so happy is people are getting more information on. So we tend to, in society, women birth babies and then they get sent home and they're like, bye, thanks. And it's like, okay, well, I am not prepared for this at all. So if you have a doula, a birth doula, she's hopefully going to help prepare you for those early weeks postpartum. But the wonderful thing about postpartum doulas is that we come into your home and we help you postpartum.
That's huge.
So it's huge. We help with breastfeeding. In those those first 4 weeks of breastfeeding, if you choose to breastfeed, are crucial in establishing a milk supply, establishing a really good latch. And that is the most common struggle that we're hearing from families that we're seeing with our clients, is that with proper education prenatally from your doula or taking classes or courses, it helps to bridge that gap so that when you bring your baby home, you've got some information, you've got some backup. A postpartum doula will come in, help you with feeding, but we also help make your life easier. So we do laundry. I can't tell you. Oh yeah. I can't tell you how many loads of baby laundry and folding people's clothes. It just takes the stress off of these. Yeah. So
amazing. I didn't know you guys cook too?
We do.
What?
Oh my gosh.
We'll cook you meals. We make sure that you're fed. We help prep the kitchen. It really is tailored. Not every family feels that they need that aspect, and that's okay. So for some families, it's strictly baby care. It's help me learn my baby. What can we do to sort of make this easier? And for some families, it's the whole shebang. I tidy kitchens. I put the dishes in the dishwasher. I unload the dishwasher. I'll sweep. I'll help tidy up the toys from young toddlers that are running around.
That's amazing.
I will baby wear your baby while you guys go upstairs and have a nap. We'll baby wear your baby and hold him or her while you guys go out and get a coffee. Sometimes it's that feeling of just being touched out. Parent, you have a baby on you 24 hours a day, and you really just sometimes need a half hour to yourself. Sometimes. Oh my
gosh. That's the selling point right there. So you're coming over. I'm telling you right now, sign me up 2021, because that's when we want to have number 2. Yeah. So lock me in. Just put me in your books, because
I will lock you in for sure. A lot of people don't realize that this is what we do. We want families, we want to bridge that gap. It really is about making families. It's tough. There's a lot of hormones that are happening after birth. It is overwhelming. Even if you've done it before, it doesn't matter if this is baby 2 or baby 3 or baby 4. Bringing home a new baby is tough. You're learning how to become essentially a new family. Every addition, your roles change and you have to adapt as a parent. And so what better way than to have that emotional support there? You know, for some families, it is all of those things. It's the cooking and the tidying and the helping so that you have to do less. But for some people, it's really sitting with them and just working through that birth experience. How did you feel? Are you having some, some little issues that you want to work past? We're kind of like your therapist and your best friend and your helper all in one.
So if anybody's listening to this and they're like, I don't want a doula, then they're crazy. That's I'm not allowed to say that. But you know what? Like, listen, our goal as chiropractors is to help support our patients as best we can. Obviously, we do more of the neurostructural things, but having that personal hands-on coach and all that, like that to me is huge. You better believe that, we actually do have your cards and stuff over here. So we definitely talk you up. We definitely make sure that at least they know you're available, but this is going to be huge. So you better believe that with that, conversations also coming. Now you're watching this video and or the podcast. So I think this was really good. We are running out of a little bit of time here, but right there and then, I think that's going to help so many people just understand, the benefit and just how like that can be such a game changer for so many people that they really, really do need to use this. Welcome to 2020. And, we do have a lot of great resources. People don't know that that's available. And I really do hope that they do contact you and get a hold of you, especially if they're anywhere near, Halton. How far would you go out?
We do travel. I mean, doulas go where the babies are born. Like,
Okay.
So families need us. We do have a limit. I mean, Peel, Halton, Guelph, so Oakville, Burlington, Hamilton, Mississauga, Brampton, like kind of our little hub. Toronto, some parts of Toronto. We tend not to go too far east, but sort of like that Western Toronto area.
Perfect.
So an option. So we're pretty flexible.
All right, people. So if you're in that area, get a hold of Nicole. I know she's going to take care of you. And we're so thankful that you joined us on our little Zoom meeting here, but our podcast. And we're going to have, like I said, everything's going to be loaded. So people can have all your links. They're going to have access to you. And if they have any questions for you, please, please, please reach out. And thank you so much. That was a lot of fun. Like, it was
awesome. I learned a lot.
I always learn a lot. So you told us a lot, and we're really thankful. Thank you so much for joining us.
Thank you so much for having me, guys. I really appreciate it.
All right. We'll talk to you soon.
Bye.
Bye.